Good afternoon. My name is Camille Crary. I am the Director of Legal Services and Policy at the Ohio Alliance to End Sexual Violence. I am here today with our Executive Director, Rosa Beltre, and Representatives Erica Crawley and Juanita Brent. And we are looking forward to a really robust discussion today on the strategy behind House Concurrent Resolution 31 and Senate Concurrent Resolution 14, and how we can continue to help not only pursue that legislative goal, but also many other legislative efforts that are currently in place and have been planned for a long time that achieve similar goals and ends. And so with that, I'm going to welcome Rosa to share some opening remarks, and then I'll introduce our speakers.
Thank you very much, Camille. And once again, thank you so much, Representative Crawley, as well as Representative Brent, for being with us today. The Ohio Alliance to End Sexual Violence was actually formed by a group of concerned public policy-oriented citizens to ensure that there was a state-level voice for survivors and co-survivors of sexual violence, and those working on their behalf through the commitment of the board members, staff, volunteers, rape crisis centers, allied partners. OESV is well represented, effective, and inclusive as a statewide sexual assault coalition. For us, it is imperative to declare racism as a public health crisis, and also understanding that we need to promote racial equity. As we're doing this work with intentionality, as we are going back to the roots, not only of the movement, but also as the United States, as a nation, understanding that there is a voice that needs to be amplified, that there is much work to be done, that things are not equitable, accessible for everyone. We are honored today that you have decided to join us and participate in this honest conversation, as we understand that in order for a lot of the things to change in the state of Ohio, that we need to increase public awareness about sexual violence, how it actually affects survivors, but also we need to be there at the table informing and shaping public policy that also affects underserved, marginalized populations. And we need to do that understanding that there are two pandemics right now in the United States, that one is COVID, but the other one is racism, and that it has existed for over 400 plus years. So the time is now for us as a community of practice, for us as a statewide coalition, but for us as a nation and as a state to stand in solidarity with survivors, with communities of color, with underserved and underprivileged communities that are not receiving the services they need at a macro level, and also as a community-based level. So we are excited for this 2 hours of conversation. We thank all of those that are participating with us today. We will record the conversation, and our member-based agencies will have the opportunity once again to go back and listen to those conversations. We ask that as you are engaging today, right, that you lean in and understand, as we talk about the House Concurrent Resolution 31, that we also think about Stephanie House, as we are wishing her much health and speedy recovery with COVID, and appreciate how honest she has been in reference to this whole conversation, and also honoring the fact that she was one of the ones that introduced this bill and is fighting very heavily in conjunction with Representative Erica Crawley to have this passed, not as individual counties, right, but as a state of Ohio declaring racism as a public health crisis. So thank you for your time. If you do have questions, we're going to ask that you do participate, put them in the question box or chat, and we will monitor those at the end. Camille.
Sure. Thank you so much. So before I introduce our panelists, I just want to go over a little bit of the structure for today. We are going to talk about generally the structure of what a summer recess is and how that impacts this legislation and other legislation. And we'll also talk a bit about the COVID-19 implications. We'll become acquainted with the representatives that have so graciously joined with us today. And we will, again, really focus our discussion on the concurrent resolution 31 and additional legislation, and really sharing as much information and gaining as much knowledge as we can to support those efforts in Ohio to help and embrace what Rosa just explained. So without further ado, I do want to welcome our speakers today. We have two representatives on board today. Representative Juanita Brent is a graduate of the Cleveland Heights Beaumont School, which is just down the road from my house. And she always knew she wanted to serve communities in her hometown. As a member of the Cuyahoga County Democratic Women's Caucus and a former member of the Board of Trustees for Healthcare Service Corporation, the largest customer-owned health insurer in the country, Representative Brent knows how important it is to provide women and families with access to affordable, quality health care. Prior to holding elected office, Representative Brent also worked as a field director for the Ohio Democratic Party and founded the Social Society of Cleveland, a nonprofit networking organization. She currently sits on the board of the Harvard Community Services Center, Lee Harvard Community Development Center, and is eager to bring her experience to these issues. And Representative Erica Crawley represents Ohio's 26th district. She brings a wealth of advocacy experience to the Ohio House of Representatives, having worked on behalf of children and families as a court-appointed special advocate for children and in positions with the YWCA Head Start Early Start Program and the Black Child Development and Institute. Rep. Crawley served in the U.S. Navy. She holds a JD and an MPA, and her legislative priorities have focused on maternal health, infant mortality, birth to 5 initiatives, housing and food insecurity, and veterans issues. She serves right now on the House Finance Committee, the Finance Subcommittee on Primary and Secondary Education, Primary and Secondary Education Committee, Armed Services and Veterans Affairs, Correctional Institutions Inspection Committee, and was appointed on the Governor's Commission on Infant Mortality. So we are thrilled to have you both here today to discuss House Concurrent Resolution 31. And with that, I will hand the mic over to Representative Crawley.
Thank you so much, Camille, and thank you, Rosa, for having me and my colleague, Representative Juanita Brent. Thank you to the Alliance and everyone who has tuned in today to have this conversation about HCR 31, along with SCR 14, which is over in the Senate and has had 2 hearings thus far. As Rosa said, we are dealing with 2 pandemics in the country and definitely here in the state. And one is COVID-19 and the other is racism. I do want to give a quick shout out to my joint sponsor, Representative Stephanie House, who is battling COVID-19 right now. So I just ask everyone to keep her in your thoughts and prayers as she is on the road to recovery. And then also to my joint sponsors over in the Senate, Senator Herschel Craig and Senator Williams, who have been, pushing for hearings over in the Senate, staying there for hours. I think the first hearing was over 17 hours. They stayed the whole time, making sure that people were able to provide testimony and as well as written testimony. And then when it had its second hearing, I think that hearing was like 12 hours and they were there the whole time, standing with members of the community who want to see these resolutions move forward and have a real impact in the state of Ohio. And before I really get started into the details of what HCR 31 would do as far as declaring racism as a public health crisis, I just want to say that, when it comes to racism or declaring it as a public health crisis, everything is kind of, everything in our daily life is inextricably linked to each other. So whether we're talking about housing discrimination, whether we are talking about law enforcement violence, health care and the discriminatory effects of that, when we see our neighbors going into the healthcare system, like I said, housing, education, transportation, all of it goes back to the structures and the systems that we have in place and how they have disproportionately impacted communities of color in particular and Black people for well over 400 years. And even now, as we see with the Supreme Court ruling on discrimination for the LGBT community in employment, we see how transgender brothers and sisters have been impacted by racism and homicide and murder and hate crimes, and really doesn't get the publicity that it deserves, which is unfortunate. So all of these things tie into what we're trying to impact with legislation and declaring racism as a public health crisis. So some of the details of the resolution are it's more than just a declaration. There are actionable steps that we would like to take and engage communities of color. We are looking to actively work to dismantle racism by promoting equity in government and society. HCR 31 would establish a glossary of terms and definitions concerning racism and health equity. It would assert that racism is a public health crisis affecting our entire community, whether you are a person of color or not. As I said, we are, and our issues are inextricably linked. And it's important that people understand that if we have parts of the community that are being disproportionately impacted, indirectly and directly, it affects other communities as well. We would like to incorporate educational efforts to address the dismantle racism and expand the understanding of racism and how racism affects individual and population health. We are also looking to commit to review all portions of the Ohio Revised Code and codified ordinances with a racial equity lens. We are looking to promote community engagement, actively engaging citizens on issues of racism and providing tools to engage actively and authentically with communities of color. We are looking to commit to conduct all human resources, vendor selection, and grant management activities with a racial equity lens, including reviewing all internal policies and practices such as hiring, promotion, leadership appointments, and funding, as well as promote racially equitable economic and workforce development practices, promote and encourage all policies that prioritize the health of people of color, and support local, state, and regional and federal initiatives that advance efforts to dismantle systemic racism and mitigating exposure to adverse childhood experiences, or ACEs, and trauma training in all elected officials, staff, funders, and grantees on workplace biases and how to mitigate them. HCR would also partner and would allow for partnerships and alliances to build with local organizations that have a legacy and track record of confronting racism directly, encourage community partners and stakeholders in the education, employment, housing, and criminal justice and safety arenas to recognize racism as a public health crisis and to activate the above items that I had already outlined, and secure adequate resources to successfully accomplish the above activities and initiatives. And I just want to say the Ohio Legislative Black Caucus, along with the Women's Caucus, over a number of years have been advocating and pushing policies to really address racism directly, whether it's paid family leave, sentencing reform, bail reform, housing, having health impact statements, and or having a health equity interagency team. It's just a number of pieces of legislation that have been introduced over the years that would address some of the disparities, and unfortunately, most of them have not gone anywhere, and we have reintroduced legislation this General Assembly, and I know we'll get to that here shortly. I want my colleague to chime in here, but you know, this has been a commitment for us, and it just so happens that right now, prior to the George Floyd murder, as we were dealing with COVID-19 by itself, we have been able to see the disproportionate impact that COVID-19 has had on communities of color because of the systemic policies that have been in place. When we look at redlining and how that had a impact on health disparities for diabetes, sugar, asthma, and things like that. Those people who have those morbidities are more susceptible to contracting the virus and having complications. And so, we were dealing with that. And then on top of that, had George Floyd be murdered, and then really raise an awareness of, yes, we have COVID-19 and we have health disparities, but there is a system of oppression that people of color have been dealing with. So as we talk about COVID-19 and healthcare, that's one. We have law enforcement violence, where the APHA had declared law enforcement violence a public health crisis back in 2018. That's another issue that we have to address, but we still have housing disparities. We still have criminal justice reform that we need to tackle, and how that has a disproportionate impact. So I just want to try to connect the dots and see how all these things are interlinked, and we can't address one thing without talking about the others. And so with that, I'll stop and let Juanita jump in.
So we appreciate your very thorough overview, and we are just having a little bit of technical difficulty. So while we are, one of my wonderful colleagues is currently on the phone with Representative Brent, and we are working against the universe at this point, trying to get that set up. So with that, I will, ask a couple of follow-up questions just while we work on getting her on board. But as you mentioned, there have been numerous efforts to work on these issues prior to this resolution. And I recall reading in the press statement that accompanied the resolution's introduction that there had been many, many efforts that had seemingly fallen on deaf ears. And so as you were caucusing, and one of the, the questions that we have, or that we'd like to share with folks, is what caucusing looks like in general, but also what it looks like now when you can't be in the same room together. And so if you could share with us a bit about the caucus's discussion on choosing to do a resolution. I know that they've had hearings on this resolution in the Senate, and my understanding is that with a resolution, you don't have to have hearings at all. And so we're curious about whether the Senate hosting hearings was something that you all were supportive of, or if that was something that you felt was hindering progress. And so I will leave there.
Thank you, Camille, for that question. So when it came to the resolutions and having a discussion with the Ohio Legislative Black Caucus, we knew that that was, and this conversation started out with a number of members in the caucus, and then President House came and asked me if I would be a joint sponsor with her. The thought was that we would introduce this legislation right before we had it drafted and introduced. Franklin County Board of Commissioners and Franklin County Public Health had already declared racism as a public health crisis, and there was already in the works a conference with the Ohio Public Health Association to talk about racism as a public health crisis. So this was just like an extension of that. And so when we introduced the resolutions, the thought was not that there was going to be hearings, because there doesn't have to be, as you pointed out, but that our colleagues on the other side of the aisle would agree that racism is a public health crisis, and that we didn't really have time to sit on this legislation, that it was imperative that we go ahead and move forward and just go ahead and bring it to the floor for a vote and to have it be declared. Unfortunately, that was not the thought process of the majority. On the Senate side, meeting with President Obhoff, he said that he would bring it to committee right away, schedule it for hearings, and move on it pretty fast. And so, in working, being in the super minority, me and my colleagues who introduced these pieces of legislation, understanding that when you're in the minority, a lot of things go to negotiating and trying to figure out where we can find common ground and collaborate and move things forward. And since the Senate was willing to move on it, obviously not how we had envisioned, but was just willing to have hearings and further the conversation, we were okay with that. Over in the House, there has been no interest in moving this legislation at all. We are on recess in the House. The Minority Leader, Amelia Sykes, has asked or requested and demanded that we come back from recess because COVID-19 has not taken a recess. Neither has racism, and there's work to be done on behalf of 11.7 million Ohioans, but we're still not, we have not been called back. And so we would hope that when we do come back to the legislature, that this comes to the floor for a vote at the very least. That is my hope. So in caucus, we have conversations. The Ohio Legislative Black Caucus works in partnership with the Ohio Democratic House Caucus. And then we try to work with our colleagues across the aisle.
Great. Thank you for sharing that. We are working on having Rep. Brent join us verbally, at least, or audibly. And so we are just pushing a couple of buttons. And while I'm doing that, oh, I believe she is unmuted. Double check. All right, I just have to send her a pin. Okay, we should be able to hear from her in one moment, and we appreciate your patience with this. So you had mentioned that there has been action and activity in the House. I suppose action and activity are the same thing, or in the Senate. What has this looked like at the House level that's been different than what has happened in the Senate?
So I think the biggest thing is that the Senate has not taken they're not on recess. They're continuing to meet. Committees are meeting, holding hearings on the Senate Concurrent Resolution 14, as well as other bills in the legislature. And even though they are meeting and voting on important pieces of legislation, if it has to come back to the House, we're not meeting, and so that legislation isn't moving. So that's the biggest thing. They are continuing to do the work that people have elected us to do. And in the House, we're not meeting. And I do want to say that even though we're not meeting, I can speak for me and my colleagues, we continue to work on behalf of Ohioans. Like, we work for you. We were elected to do a job. People are still suffering from unemployment issues and not having, not have received a check, are scared of being evicted, are in some pretty terrible situations, and they're looking for help. So even though we're not meeting and having committee hearings and voting in chambers, we still are working. But we would like for the House to come back and vote on legislation.
Thank you very much, Representative. And as we continue to ensure that Representative Brent is able to connect, is this bill, right, or this resolution or this work, is it personal? For you, for the co-sponsors, for Ms. Brent, and the reason I ask that, right, is because we constantly in this field of anti-oppression and working against racism hear so many buzzwords, right? Whether it is to get a grant or to do the work or co-conspirator or allies. Is this personal, and why? Indistinctively of George Floyd and everything, that if that would not have happened, would we still go ahead and make this a priority and personal issue so that it actually does pass?
Thank you so much for that question. Absolutely, it's personal. As my colleagues and I have been having interested party meetings around police reform, and we have pieces of legislation that we're pushing. The majority has a bill that they are pushing, and we have made it known that we're not working on racism as a public health crisis, law enforcement violence, because it's politically expedient. These issues affect our community and have before George Floyd and after. And so had George Floyd not died, we still were going to be pushing this resolution, because we still see, we can't talk about racism as a public health crisis and not talk about education and how communities of color are disproportionately impacted by not getting the resources that they need, having subpar schools, and outcomes related to that. We can't talk about racism as a public health crisis and not talk about redlining or talk about how families don't have running water, and the eviction rates for Black women in the state of Ohio or here in Franklin County where I serve is higher than any other group. We cannot have these conversations without talking about how racism has played a part in it. And I am a Black female legislator who have been impacted by profiling, by going into a healthcare system that does not treat me equitably and fairly when it comes to maternal health and infant health. I have experienced that. I talk about it quite a bit. That is one of my priorities. And it is a priority of mine because I have experienced it firsthand. And we continue to see women dying and babies dying because they are not listened to, or they aren't believed, or there's this thought process that, as one of the legislators said in the Senate during one of the hearings for SCR 14, that when it comes to COVID-19, our people of color or colored people, actually is what he said, colored people more inclined to have COVID-19 because they don't wash their hands as much as or as well as other groups. And so if we just think about where that comes from, first of all, the term colored population has been around for decades, as well as this thought that Black people or people of color are less hygienic. And this is a legislator who is a doctor, who is an emergency room physician. And so when we hear about like just the link, so just knowing that he has that thought process about people of color and their hygiene. Imagine a Black woman experiencing preterm labor or going into the hospital saying that, she's having some symptoms, and he could possibly say, well, maybe you just need to wash your hands a little bit more. You need to be a little bit more hygienic, and totally dismissing what she may be dealing with is how we see infant health or infant mortality, or we see maternal mortality arise. And that's just one way. So these things are personal. And as we talked about my colleague, President House, dealing with COVID-19 right now. Senator Williams talked about her experience trying to get a test and how long it took for her to get her test results, and just the hoops that she had to go through. These are legislators. So imagine what we are dealing with as legislators compared to just regular people every day, just trying to live their life and provide for themselves and their families. This is absolutely personal.
Thank you so much for answering that. And I was actually there providing testimony the day that was said. And it's very personal for me as well, right? So not only from an organizational structure, right, and the work that we do and doing it with intentionality, is understanding, right, that why is it that so many of us are unable to receive the medical care that we need, or are reluctant even to go to Main Street hospitals, and understanding because they don't understand our needs or the services, or when we're complaining about pain, how easily that is dismissed. Because we're more tolerable to pain, right? And we also have a codependency of getting hooked, as some of them have mentioned, to painkillers, or utilizing. So there's a lot of gamma, right, in reference to how that is interpreted and said, and understanding how it does affect indistinctively of our knowledge or power or spaces that we cover or privilege that we might have because of our positions, that it is very personal just by the fact of the color of our skin.
And to your point, real quick, we have seen just recently in the news how trans women or trans men have been treated or not treated at all when they are having a healthcare crisis, and how they've been discriminated against from the ambulance coming to wherever they are for need and not getting the treatment that they deserve, to going into the hospital and not being treated fairly or equitably or humanely. And it's just, it's unfortunate. It is a crisis in and of itself. And we as legislators have an obligation to make sure that every person is treated fairly, treated with respect and dignity, and have access to whatever they need when they need it, and that they're not discriminated based on their gender or their skin color.
Sorry, Camille, it seems like you are muted.
I am muted, thank you. I didn't want to interrupt, but we appreciate your statements on that and sharing your personal experiences. And I just wanted to let everyone know that we've been able to connect Representative Brent verbally. We will not be able to have her on camera, but we appreciate all of your patience with us in this process. And I just want to reintroduce Representative Brent. She is a graduate of the Beaumont School in the Cleveland Heights area. She is very active and has a lot of experience in organizing and community development. She is a former board member of the Healthcare Service Corporation, which is the largest customer-owned health insurer in the entire country. And she has a focus as such on healthcare and affordable, high quality services for women and families. Prior to holding elective office, she worked as a field director for the Ohio Democratic Party and founded the Social Society of Cleveland, a professional networking organization. And she currently sits on the board of the Harvard Community Services Center's Lee Harvard Community Development Center. And so with that, thank you so much for your patience, Representative Brent. I cannot tell you how much we appreciate it, and we look forward to any thoughts you have on the bill that you'd like to share.
No problem. Can you guys hear me?
Yes.
Thank you. I so wish you guys could see me because I'm enjoying watching all the ladies talk. Shout out to my lovely colleague, Rep. Crawley. She is awesome, and she's really holding it down all by herself. I just feel like I'm just an added appetizer to this whole entree she's giving you today. But HCR 31 is something that we all have to live our lives by as legislators on everything that we do. One of the things that stuck out the most is about dealing with racial equity when we deal with any of our bills. So even as the ranking member on agriculture, everyone always asks me, hey, you're Black, you live in urban Cleveland, why are you so concerned about agriculture? Because in Cleveland, we have a lot of food deserts. We have a lot of not access to people having jobs, even in agriculture fields, which actually pay really good money. We have a lack of education of where food is coming from, where a lot of our milk here in the state of Ohio comes from China, not Ohio. Good point for you guys to remember. So as we talk about inequities, about just our laws, we also have to think about where our food actually comes from. And also that within 2020, we have money that comes from the CARES Act that goes to our county independent fairs, but we're not prohibiting Confederacy memorabilia. So when you talk about racism being a public health crisis, it affects so many different layers of our government, we don't even realize it at all. So I'm so proud to be a co-sponsor of this bill, as so many other people who have signed on, because this becomes my duty to look at everything that I introduce or that anybody else introduced and say, how can we look at this in the racial equity lens to make sure that all people are being represented, all people are being included in this process?
Thank you so much, Representative Brent. I am wondering if you can speak a little bit more to, you mentioned that there are a proliferation of issues that everyone needs to be focusing on in this long-term effort, and agriculture is the one that you mentioned. Can you speak a little more to, what it looks like to be reviewing legislation on a weekly or daily basis, and what types of legislation come up most frequently that would relate to this specific resolution?
Well, one of the things that just came up recently, and it was a bill, House Bill 665, which deals with the updating of our county independent fairs. Since I was a small child, I and probably many other people went or at least thought about going to their county fairs during the summer, where you learn about agricultural skills, or you might have raised an animal, you might have grown some type of crop during that time period. And the Red Book, which all county and independent fairs have to live by, it's basically like their Bible, hasn't been updated in decades. So when we're trying to update something so valuable as their Red Book, we have to look at it as a racial equity lens. So this is the perfect time to bring the county and independent fairs to the same standard of the state fair, which currently holds the policy that it prohibits all Confederacy memorabilia from being sold, expressed, or displayed anytime during the state fair. And that amendment we tried to add that amendment in, but it was tabled. Basically on party lines, it was only one person outside of my party that was willing to go along with it. But we have to look at that and everything that we do, because people have to be welcome, particularly when you talk about places that are receiving tax dollar funding to exist.
Thank you. So you've mentioned that a lot of these votes fall on party lines. And as Rep. Crawley mentioned, the Republican Party has a supermajority in, I believe, both houses. And to that end, one of the strategies that we engage in an effort to advocate for certain funding streams or other legislative goals is getting municipal governments and county governments to either adopt their own version of that law or to specifically pass a resolution asking the state legislator to do the same. In a situation where everything is falling so much on party lines, is that a valuable use of advocacy, energy, and time? Or are there other ways that our members, for example, can be of assistance in this supermajority situation that we find ourselves in?
Well, when things are not going as planned within the state level, we have to take it to the people. Literally right now, I'm in Elyria sitting in my car. That's probably why my video is not working. Not because it's Elyria, but just because I'm not sitting at home in Cleveland. But the reason why I'm out here in Elyria right now, because we are trying to stop the vote for the Confederacy memorabilia being allowed at their county fairs. So you have to go where the people are. And it was Republicans and Democrats. It was even a couple people who were libertarians who showed up for it, because this is a people issue, not a party issue. Sometimes when we look at it from the state level, you see the votes lie upon the different parties, but when you come down to these local municipalities, people are tired of being sick and tired, and people want to belong. And not every Black person is a Democrat, not every white person is a Republican, but we're all human beings. And when you see things like this that deals with racial injustice of having a flag that symbolizes people who want to keep slavery alive, that's a people issue, nothing to do with partisan, because Abraham Lincoln, who lost his life to get rid of the Confederacy flag, was a Republican. So this is just so much bigger than party lines. This is people. So people have to get involved at the very local level, and you can do that by having your local municipalities even pass resolutions like that to support what we're doing on the state level.
If I can just add to my colleague, Rep. Brent, what she said, I think for your advocacy, it's important that, because it helps us as we try to pass different pieces of legislation that will, support survivors. We have to have those conversations at every level of government. And I think when the local municipalities pass resolutions or ordinances that to that effect, it just puts more pressure on the state level. And I think it's important that, even for us as legislators, even though we're in the super minority, And we have to, have our colleagues across the aisle be on board, and, support our work. At the end of the day, the people who elected us really don't care about Democrat or Republican. They care about getting the work done. They elected us to get work done, and they really don't care how we get it done. They just care that we get it done. Legally, of course, but other than that, they don't care how we get it done. And I, represent probably around 150,000 people, and it wasn't all Democrats who elected me. And at the end of the day, I don't just represent Democrats. I represent Republicans and independents whose lives are impacted by every piece of legislation that comes out of the state house and then goes to the governor's desk. And so, we have to do a level of education with our community. And as you're having those conversations with the community or the local electeds, we are able to support you and you support us. But even with our colleagues across the aisle, I find that a lot of times when it comes to some of the issues that I advocate for, my colleague Brent, they have no idea because it's not their lived experience, right? And so a lot of people tend to think, well, if I didn't experience that, then it doesn't exist, or it's not real, or it's not true. And I think by, even when you have your members or your clients come to the State House and share their experiences as survivors, that will have people think. They go back home, or maybe they're driving in their car and they think about, well, maybe I could look at this differently. Maybe the way that I've been looking at it isn't right, or maybe I've been holding some biases that were told to me as a young child, and maybe what I learned as a child really isn't true. And I think it does challenge us, and it should, that our perspectives aren't always right, and that we can evolve in our thinking. I think those conversations have to be had, and they're hard sometimes, but we have to continue to have those conversations. So if you're doing it at the local level and then coming to the state, it doesn't do anything but help us as we continue to move forward those conversations.
Thank you, and we appreciate that so much. Actually, our membership base was asking mostly because at a municipal level, the resolution has passed, right? We've had individual municipalities that have passed this as a resolution, but we see so much opposition, right, or delay at the state level. And some of them question why, right? Does it take so much effort and energy when at the individual level and municipality level, they are trying to do the right thing? And I think that for them, it is so important that they understand those dynamics and how important story sharing is, right? And those perspectives of understanding, even though there are difficult conversations. So thank you both for that. There's a lot of conversations, right, in reference to understanding or utilizing the term bill versus what's going on in particular now with this resolution, and the process and procedures for getting bills passed. Can either you or both of you tell us a little bit more of the process for the resolution, and how does it actually differ from the bill? Because this is House Concurrent Resolution 31, right? Or Senate Bill 13. So it's so different in those languages. And how can we make it click, or what is the process?
Anytime someone starts up, and I'm gonna start it off, but I know Rep. Crowley's gonna finish it off for me. But anytime you're starting off a bill, resolution, or you're starting off a bill, you always have to have interest party meetings. All of us start off with the idea. And so basically with our interest party meetings, it's talking to different people in our communities or different people who might have interest in the topic to see where they stand about it, to bring ideas together, which will come with the best conclusion of what this will look like when we are making this a written form, which in this case is the HCR 31 for the racism as a public health crisis. So after you might talk to different groups, nonprofits, or community leaders, other elected officials, you come up with all of that information to actually have the bill drafted into a form that you have introduced. So with this situation, this is something that was actually brought up to many of us, like Rep. Carly said, from our local municipalities. This was passed in Cleveland, it was passed in Columbus, as well as a couple other municipalities within the state of Ohio. And so that just puts pressure on us to have to represent the people that we represent at home. I'm from Cleveland, Rep. Carly's from Columbus. So both of our communities introduced and passed these resolutions. So when we go to the State House, we represent literally the interests of the people we represent at home. So that goes back to your point about the importance of making things very local. Everything is local. Things rarely start at the state. Most things happen on a local municipality level, and they rise up to the state, and then they rise up to the federal level. So that's where things were going. We already discussed about how we didn't need to have multiple hearings, but because there are people who do not want to see this pass, they are forcing the sponsors, Rep. Crawley, Rep. House, to have to go through the whole committee hearing. And it's just knowing the rules. We already know what the rules are. We know we don't have to have a hearing, but it's a shame that that is being forced upon our two sponsors of this resolution to make this happen. And so when I say resolution, it's the same kind of interchangeable language as saying a bill, but it's a shame that this is even happening. And normally within the process of a bill, you have the proponent testimony, the sponsor testimony, which is normally the representative. Then you have the proponent testimony, which are people who agree with the bill. You have opponent testimony, people who are against the bill. You might have a third hearing, which is the interest party, which are people who are kind of neutral and they'll give their opinion. And then the fourth hearing will be the time that the committee actually votes out the bill. Now, I've had bills and Rep. Carly's had bills, and we didn't always have to go through that whole drawn out process to have a bill voted out of committee. So to have that whole process go for a bill, but a resolution doesn't have to go through that process, and we are being forced to have to go through that is unjust completely. Because everything at the State House is at the mercy and the power of the Speaker of the House and the Senate President. So who you vote for matters. And if they don't like something, they could slow it down. And if they do like something, they could speed it up. I had just had a bill that became law. You know how long my bill lasted in committee? Guess how long, Rosa? Guess how long my bill lasted in committee?
Maybe
2 weeks.
Yeah.
2 weeks. 2 weeks. It was on the House floor on the third week. I'm just saying. And it's because the Speaker really liked the bill. So we just have to say that when people say, oh, you have to go through all these hearings, they're full of it. They're full of it. I've seen Rep. Crawley have bills. Her bills might have been in there 2-3 weeks tops, and it was on the floor of the House to get voted on. So why are we having to go through all of this to declare racism as a public health crisis?
I don't know that I have too much to add. I think she gave you the truth. And so I think, and it's funny, but it's sad at the same time, because there are bills that most of our legislation comes from our community. This is, ideas that they had, and they brought them to us, and then we, are the vehicle to move them forward. And, the Speaker really does have a lot of power. There are things, as she said, that, when they want something passed, it'll have one hearing, and they'll have they'll have sponsor testimony, proponent, opponent, interested parties, and vote all, within a week or two. But then if it's something that they're not really interested in, it could take a month of Sundays for it to move, if at all. And so I think the difference is just technically, the difference is like a resolution is non-binding. A bill, obviously, when it becomes law, is binding. For a bill, usually you have 3 considerations. When it's introduced and gets a bill number, it's the first introduction. When it gets referred to committee, that's first consideration. When it gets referred to committee, a standing committee, that's the second consideration. And when it comes to the floor for debate is third consideration. When you introduce a piece of legislation by a certain date, this year was like May 13th, you had to have at least one hearing. And bills can have one hearing and not have another hearing. Or they can have one hearing and then pass, and if they don't like it, it goes over to the Senate to die. And so, you know, that's the difference between a bill that we're trying to have become law. It has to go through certain steps. But as she said, again, even with the 3 considerations and having to have a hearing, if they like it, they'll move on it. You can have, you know, go from first consideration to third relatively quickly. And if they don't, then it doesn't move. Whereas a resolution doesn't have to have hearings at all. It can come straight to the floor. It has happened many times. And this is just something that what we see with House Concurrent Resolution 31, just another opportunity to kick the can down the street. And so it's unfortunate because, you know, with this, and I know there has been pros and cons for a resolution. People are like, oh, it's just a statement, but we're asking for a working group to come to be formed. I know people don't necessarily like working groups. We're like, we don't need another task force. We don't need another working group. We know what the issues are. And that is true. But for the things that we outlined, as far as going through the Ohio Revised Code with an equity lens, that will require multiple people. You know, and a working group will have some kind of accountability and have to report out and really can do the detailed work that needs to be done around racism as a public health crisis from the state perspective. We do have pieces of legislation, at least 30, I think 30 or 35 pieces of legislation that we've introduced in our caucus that will help address the disparities, but that's not an end all be all. There are policies that are already in place that have a disproportionate impact. And then our state agencies operate, you know, in a way that even in their operation could have a disproportionate impact, or it could be a bill that might on paper in its creation have an equity lens or was equitable at the time, but in its effect has a disproportionate impact. And so those things need to be looked at as well. So that's what we're looking at with this resolution. It's not just to make a statement and say, hey, Ohio is the first state to declare racism as a public health crisis, but it really does have some teeth to it and some work that needs to continue on after it is, you know, after we vote on it. And so, you know, as long as we continue to sit on this or kick the can down the road, lives are being affected. Women continue to die in childbirth. I say that all the time. We still have, you know, we don't have a livable wage here in the state. Definitely we see in Columbus and Cleveland and major cities how people are impacted by not having a living wage or being, you know, for women, we still have a pay equity gap, and we have bills that, you know, will address that as well. And so as long as we continue to not declare racism as a public health crisis or not move on these bills, we still have a society where people are not living the American dream right here in Ohio. And that's our Ohio promise, is that you can live the American dream right here in Ohio, and everybody doesn't have that be realized. And that's unfortunate.
Thank you. You mentioned several things about like the work group concept and having more of a committee. And I'm wondering if you can speak to the idea of a recodification. You mentioned that there would be a review of the Ohio Revised Code with the equity lens. And as you know, and I don't have to tell anyone on this call that a recodification and that large scale of an effort is going to be a really worthwhile and time-consuming investment. And has the caucus looked at that or discussed what that might look like once this gets passed, to make sure that it doesn't, as so many other recodification efforts have kind of gotten pushed or have taken on such a lengthy timeline that they haven't come to fruition? And I have seen successful recodifications in other states, so I don't want to say it's not possible. That's not what I'm trying to, you know, articulate at all, but it is a big endeavor. And I'm wondering if you can share for the folks on the call that don't have the legal background what that type of endeavor looks like.
No, thank you for that question, Camille. I'll start first, and then maybe Rep. Brent has some things to add. I think I think it's good that you asked that question, because that has been some of the pushback that I have heard. Like, oh my gosh, like this is going to be a Herculean effort, trying to go through the whole Ohio Revised Code, and how we do that. Well, one, we have a law in place that anytime we implement a new law, another one has to be taken out. So that's one way. As we pass legislation that the governor signs and it turns into law, we could be looking at what is taken out of the Ohio Revised Code. And that came back, that was done a few General Assemblies ago for check and balances, or to limit government. I think also what we can do is stop the bleeding. If we continue to implement laws and we don't have a racial equity lens or a health equity lens, then we will continue to see disparities. And so one piece of legislation that Senator Tavares had been working on for past General Assemblies before she left the legislature was health equity in all policies. And so that it had 4 pieces of 4 things that legislation was supposed to do. I have reintroduced this General Assembly and just focused on 2 aspects of that, and that's health impact statements and creating a health and equity interagency team. So health impact statements would be where anybody who introduces legislation will have a health impact. Like, what is the positive, negative, or neutral impact to different communities, whether it's urban communities or rural or Appalachia, or women versus men or children, or, if it's something that's environmental, it could exacerbate issues for people who have asthma or something like that. That is something I think we could do to stop the bleeding and stop the disparities that we see in our legislation. Having a health and equity interagency team would require there to be a health and equity person identified at every single state agency. And to look at what their policies and procedures, and they get together as a work group, and then they have to provide a report at the end of the year every year on policies and procedures, implementation, and what we can do, and make recommendations on how to make that better. So just off the top of my head, those are things that we've talked about. And since we already have a law in place that when we implement new laws or a piece of legislation is passed, that we have to, look at removing one to have checks and balances on government and not having it get out of hand, that's one way that we can do it. I don't know if Rep. Brent has some thoughts.
I think you just basically summarize it, so I'm gonna leave it with that.
And I can add, I have not looked at what other states have done in particular and how they have been similar or dissimilar. I will have my legislative aide look at, get research from NCSL to see, outside of what I just mentioned, what we can do to make that an easy process. But these things, we didn't get here overnight, right? It has been several years in the making since the founding of this country and since the founding of Ohio, the state, that we have had policies in place that have had an impact on racism, on health, on everything. And so I think it would be unfair to think that our resolution will change things overnight. It's a start, and one that we should have did long time ago. And unfortunately, this is just where we are right now. But this will be an effort over time, and it will take all hands on deck. That's why it's important for municipalities to pass this type of legislation, because we all will be working together, and then working with organizations like the Ohio Alliance to End Sexual Violence to help us move this work forward. And it'll be your organization and your members who will say, hey, maybe you didn't think about this or this piece of legislation or how it would have an impact on survivors, but we think you need to reevaluate this, because in its implementation, the impact is having an impact that I don't think people anticipated or had unintended consequences. This is how we will work together going forward.
Thank you. We appreciate that. Ohio tends at a national level to be at the forefront of a lot of things, right? So we start conversations, we have the resolutions, we have the dialogues, some of the groups, we go into hearings, right? or we publish statements, hoping that not only with COVID, but even with this particular resolution, that we would have an opportunity to be a best practice model state. But it continues to digress, right? And after the statement was published, the Ohio Legislative Black Caucus expressed that by being the first state to adopt the resolution, we hope Ohio can be the model for the nation, showing that the rest of the country how we can lead these difficult discussions and enact real and meaningful change. But unfortunately, it continues to be like not a priority, or as you mentioned before, right? There's so many layers and even red lines and tape and at the statewide level. How do we see that this resolution can change where Ohio stands in, right? In the midst of an election year, in the midst of everything that we're going through. And even though we have not necessarily been in Atlanta or in Chicago, there is a lot of racism occurring in Ohio, has been for a very long time, right? So how can we move this forward, be adamant about the need, and also continue to lead the nation in these conversations?
First of it has a lot to do with just terminology. You know, Ohio is leading in a lot of things, some things good, some things bad. I'll just use, for instance, infant mortality. Rep. Crowley is our queen at bringing up wonderful legislation for that. But even with that, our state just bragged about how good we were doing with infant mortality. But that was only for everybody but Black people. So when we talk about things that dealing with things from racism as a public health crisis, it's talking about right sizing it to fit populations of people. So if we are doing well in one area, we don't need to keep putting money towards communities that are being successful already. Let's go right size it to help communities that are not doing well at it. So that's how we have to look at our laws and our policies. Where are we not doing well at? It's not always about just how we are doing as Ohio, but where are those pockets that we can do better at as a whole? So even to talk about criminal justice reform, if we are having problems with police brutality and it's only happening in certain areas, then we need to right size where that information is going on, because maybe they're not having that issue over here, but then over here in another area, they keep on having that same issue. So we need to get down to the root of that problem. So until we can right size and deal with the racial inequities within it, then we're not going to go as far as we need to go.
I would just piggyback off of that. I think when we talk about right sizing, for instance, a couple of things, but to the maternal and infant health conversation that Brent brought up. She hears me say all the time, I get so angry when the governor talks about the commitment to infant mortality here in the state, especially when it comes to African American babies. And he talks about that because there was some money put in the state budget last year that went to like home visiting and things of that nature. And then House Bill 11, which Representative Stephanie House just passed with Rep. Manning, was about smoking cessation and some money towards group pregnancy, and then allowing another dental cleaning. And that's all well and good. We need, I think it was like a total of $11 million, which is just a drop in the bucket compared to our budget. But we really aren't getting at the heart of the disparity, where we have Black infants dying at 2.5 to 3 times the rate of white babies. And we have Black mothers dying at 2.5 times that of white women. And we do lead the country in infant deaths. We are one of the worst. We went from like being 50th in the country, the worst state, to 48. And now I think we're at like 42. Or 43. We have a lot of work to do. And so when we talk about right sizing that, or equity, when it comes to infant deaths, we already met Healthy People 2020 goal for infant deaths when it comes to white babies. That was met back in, I think, 2018. We need to look at putting funding or moving funding to the disparity in Black babies. And so does that mean that we're not focusing on white babies? Absolutely not. I don't want any baby to die. at all. But we don't see a decrease in the disparity that we should, because we don't have enough resources and we haven't been targeted. That's how we do that. We look at our funding and where is our funding going, and is it going to communities and organizations on the ground that are like doulas, who are, we know that when it comes to Black women or people of color, doulas are a significant, invaluable resource. It makes a difference. Are we putting money towards that? Are we putting money towards, other resources for community health workers and, things of that nature? We have to talk about housing. We have to talk about racism, because we see when it comes to Black infant deaths and Black moms dying or people of color, that even if you hold for or control for education, income, women who are highly educated and have higher incomes are seeing deaths at a higher rate than low income. And that's because we are closer to the racism, our close proximity to racism, or going into systems where we are the only minority in the room and then subjected to racism, or going into a healthcare system and subjected to discrimination, impacts our pregnancy by toxic stress and stressors and things of that nature. So if we're not addressing racism, if we're not targeting the disparity, and we're not having conversations about how doctors and nurses interact with people of color and understanding their issues when they come into the healthcare system, then we're never going to see the decrease in deaths that we want to see. So we can put Band-Aids all over it. We can, of course, we need more dental cleanings for people who are Medicaid recipients, because infections, impact a pregnancy and can do so detrimentally. Absolutely, we should do that. But it does not matter what we do and how much money, if we think about the millions of dollars the state has put towards infant mortality and maternal mortality, and we're not really seeing a decrease, then we need to get to the root cause, which is racism. And we can't keep sugarcoating that. But even when we see the criminal justice system, and we see how, even in this conversation about law enforcement violence or profiling, and where I think Black people make up 13% of the population, but make up 46% of the people who are incarcerated, we see that we are overrepresented for small, like low-level offenses. And then how does that have an impact on our communities when you're taking either men who are providers for their families and incarcerating them, or we have a system where people can't pay their fines, so we're in debtor's jail, and you have removed someone from the household who is a provider, and then you have others who are struggling to make ends meet, or might be in a place where there's food insecurity. If we don't deal with those root causes, we'll never see the difference that we could in Ohio really being a change agent. We can, because we're like leading in some bad places. And if we just make some adjustments and deal with the root causes, we really could be a leader in the country. So I won't belabor the point, because I think you get it. But we have some work to do, and I don't think it's hard. We just have to have a will and to do so. And I don't think that the people that I serve with, the majority does not have the political will, unfortunately.
Thank you so much for that. And as you're talking about political will, and the resolve to sit down and think about these very urgent issues, we are in a situation where I imagine it's very easy for your peers at the legislature to flip well, we are in the middle of this other pandemic that we're going to prioritize, and therefore we cannot address these issues, despite the fact that the approaches that they're choosing to take maintain the same disparate impact. So I'm wondering if you can speak to some of the remedies that have been proposed around COVID. One of the things that we saw were, I believe it was House Bill 606, and I think Senate Bill 308, if those are the numbers, around the immunity for healthcare providers and businesses opening up, and certain legislation that was being pushed forward that was really in our minds, detrimental, and was not focusing at all on the disparate impact of people of color. And I'm wondering how cooperative or collaborative folks are willing to be at the State House right now with what I imagine is a very rushed, or a feeling that everything has to go through so quickly right now because of this other pandemic that is taking priority.
Well, even with House Bill 606, we can still talk about racism as a public health crisis. It affects every bill that we do, because if you're talking about first frontliners, a lot of frontliners that I see in my community, I see in other people's community, are African American people. So when you tell somebody you have to go to work, you have to go work at the nursing home, you have to go work at the hospital, you have to go work at this clinic, and your job can have immunity and you got COVID there, that is a problem. That is a problem. How are you expecting a mother, a family member, a sister, a father, a grandparent to be going to work and their job can have complete immunity if something happens to them? And that disproportionately affects, Black women, particularly because they tend to be the breadwinners within their families. So this is always a topic of dealing with racism as a public health crisis. Just in the terms of that, I personally voted no for the bill because I do believe that people should have their day in court, and jobs should be making sure that their facilities are as safe as possible. And the moment you tell a person that they cannot take their company to court if they were not being treated justly, is an injustice for any community. And we know there are some employers that are not treating their people fairly, and they should have their day in court if they're not treating people accordingly.
Sorry, I used to be a plaintiff's workplace attorney, so we were speaking. When I opened that bill the first time, I was just like, oh no. But anyway, I will.
Similar. So I voted against it. So I don't like immunity bills. Just from, I have a law background. And so I think, as Rep. Brent said, taking away people's opportunity to have their day in court just bothers me. And so, our businesses already have a lot of protections. They have a lot of benefits. They live the good life, from tax breaks to insurance and all of that. And so they are always put in a better position. And I think that, if you are a good steward to your employees, then you don't have anything to worry about. And so, yeah, I didn't support the bill, and I don't think that people are out here being malicious. There are some. I mean, we saw, just in the legislature, just over the last week, how staff was affected by COVID, and there was a lack of communication. There were people who had tested positive, and staff that had to quarantine, and it just so happened that some of my colleagues only got the information because one of our staffers was inadvertently sent home because they mixed up their name with another staffer. But that information should flow. That should be something like, hey, you're in a setting where people have tested positive, other people have been in contact, you need to get tested, you need to quarantine. They might have come in contact, and there should be some protections for that. And if there isn't, not necessarily for businesses, for employers, but for employees who were impacted by, a lack of communication and was exposed. And so, I just echo what Rep. Brent said, and we have to look at, for our colleagues who might say, we can only deal with one fire at a time. The communities in which are impacted are always dealing with multiple crises all the time. Would they love to be like, I can only deal with this? Or when the bill collector comes, they're like, oh, I have to deal with my electricity first, and then I can get with you to pay my gas, and then I can get with you to pay my water. Like, you all have to just wait a second. That would be great, but that's not life. That's not what life looks like when it's working. We have to be able to handle multiple things at once. And unfortunately, nobody saw this coming, but it's here. We're dealing with COVID-19, but we're dealing with racism. We've been dealing with racism. Our communities have. Now, whether our legislators have chose to deal with it or not has been on an individual case-by-case basis, but their communities are dealing with it too. There is no community or county in Ohio where racism has not had an impact one way or another. And so we have to look at it that way, that we are legislators, we are elected to work on behalf of the people who elected us, and they're dealing with a lot of things at one time, and we have to be able to handle that. And I believe that we can. It's 99 of us in the House and 33 in the Senate. We are talented, most of us, and can handle, you know, moving legislation on behalf of our constituents, and we should be able to do that.
Thank you. I like that part about most of us being talented and being real and hoping that something happens. We all know, you know, sometimes as we're talking about the issues of racism and you of color, I of color, and so many of us doing this work with intentionality, right? It's like preaching to the choir. And even understanding those dynamics that we experience it's life experience, we do it every day. How can we have the white aspiring allies, right? Those also in power and understanding that all of us carry biases, not necessarily jump on a bandwagon, but understanding that this is real, that this is true, that it affects in every aspect. It affects the school pipeline, that when we're talking about these demonstrations, right, and the free will of demonstration, and being able to actually say that Black lives do matter, right? And when we encompass, no, every life actually matters, that there is racism in that, in acquiring that when we're talking about even now with COVID and having different municipalities or areas talking about a mandated mask, right? When that could have been done in the past, and who's going to be affected with, like in Cleveland, right? A $750 fine. And labeling that as a misdemeanor when you're not utilizing that, or now the underserved, marginalized, the people of color, the farm workers, the Black, the Latinx within the communities, for these retail jobs or other jobs are now considered essentials, but the pay is not there and not enough, and they have to choose whether it is staying at home and taking care of the children, or having to go to work, or losing their job, or still waiting 4 months along the way for unemployment check to actually trickle down or come about. How can we make sure that we have this conversation and that it's not always to the same choir, right? That it's not the angry Black woman or the Black caucuses just coming together and now this is an issue, that we truly understand as humans, as communities, that this is an issue, that it does affect in a disproportionate manner, that women have been asked to pay their rent with their bodies, that they've been raped in order for them to go ahead and pay the rent. And when we talk about going back to schools that are Black and Latinx and our binary people and our rural communities don't have the accessibilities, right? And the abilities to say, oh, this is the issue and this is why, or there's no food on the table, or they're not receiving the education because they don't have a hotspot, they don't have a tablet, their phones are with minutes. And that's how they're connecting, right? And receiving the indication that it is not equitable, that it is not inclusive, that the things that we are putting ahead, we're just thinking about a small group and not the composition of all, even though we're 14. So how can we, and I don't think it's about selling a point, how can we true and have the true allies that we actually need in this work to make sure that things actually happen?
We have to keep telling the facts of what's going on. I think we have to be truth tellers. When we talk about, and I'll use this for example, when we talk about the Confederacy, we have to talk about they wanted to exist so they can keep slaves, period. And so as much as when people say, if you want people to be your allies, they first have to know what the story is and know the facts, for one, so they can be real allies and be on message. Two, people have to keep showing up. I know a lot of people say, I don't see my elected officials, I don't know where they're at. Everything from our meetings to our you know, what time we have committee to when we have session. That's all public information. To where we live is public information. If you want to find us, Google us. It's easy. Somebody just sent me a package a couple weeks ago. He was an inmate from a prison, sent it right to my home. I went to call Rep Crawley and I said, hey girl, this prisoner just sent me a package. If they want to find us, they can. So we are at a point where technology makes us very accessible to each other. Contact who you need to contact. And trust me, in that process of you doing that, you will find allies of all different races. Even for me to be sitting here in the middle of Elyria talking to you good people, is because somebody found me on Facebook and contacted me and said, hey, I like what you're doing. Come out here and come talk to my people. You will find them. And just once you find them, make sure you get your message together and keep it moving. And it will build up like a snowball of momentum where you can keep on addressing it.
I would say that I don't know that I need any more allies. I need co-conspirators in the fight to dismantle racism. That's what I need. And so I know some people are like, well, what's the difference by like having an ally? So someone who, you know, can say, well, I'm anti-racist, but, you know, just because they don't do anything overtly racist doesn't necessarily mean you're like anti-racist. But I'm looking for people who are willing to take some action and put something on the line to dismantle this system that has been in place that oppresses people just based on the color of their skin. So whether that's speaking out or educating yourself about how this system even came into existence and what does it look like? What does structural racism look like, overt and covert? That's somebody that I say is a co-conspirator in dismantling racism, and then educating someone else. And I think that we all have a responsibility. Like I continue to say that we are inextricably linked to each other, directly and indirectly. And so if you are a teacher, I think that it is incumbent upon you, even if you're in, I don't know, Upper Arlington, or you are in rural Ohio, it's incumbent upon you to do research on history. If you are engaging with students to see how to be able to teach them about, you know, just history, and not like there's Black history and then there's like US history. It's history, and Black history is a part of that. And what happened to Native Americans, and what happened, how the slave trade even came to be, and how, you know, when we're talking about racism now, what did that look like before, and how does that appear now? I think that's what we need to do, or our white counterparts can do. But then I think that it's important for us to, you know, be knowledgeable what the difference is between having a bias and having racism. I was in an interested party meeting the other day with some people, and this gentleman said, I mean, everybody has a bias and it impacts, you know, the work that they do. And it's true that everyone may have a bias, but I don't make decisions based on people's skin color. Like, I don't treat people differently based on their gender. I might prefer like watermelon over peaches, or, you know, strawberries over peaches. Like, that's a bias that I hold. But it's not like I don't discriminate based on something that people don't necessarily have you know, control over. I don't make decisions or treat people differently. And we had to, like, I don't know that he got that. One of my colleagues tried to explain like what the difference was. And it was a older white gentleman. And I don't know, even in him saying that comes from a place of rationalizing something that he may have done or said in the past. So he's like, well, everybody does this. And it's like, no, like everybody doesn't. And it impacts, you know, what you do as a person in leadership. And you have to be able to hear when somebody can correct you. And it's not like you're a bad person. It's not about good or bad. It's about educating and not having willful ignorance versus, you know, being willing to say, okay, you know, how I was taught might not be right. And I don't necessarily have to hold those beliefs myself. And that, you know, the people who held them, that's just what they thought, but I can think something different, and I can learn and be willing to. And I say that for myself and for my colleagues. We had, Brent keeps bringing up the Confederacy, because I think this was a turning point in the legislature. And we've had some very difficult bills that have come up from, you know, pro-choice and energy and all of that. But I think this was like very defining, because we had conversations about how what the Confederate flag means to people, and oppression and not feeling welcome, and people were defending that, to say, well, you know, it's about speech, it's about the Constitution. But if you don't even recognize how the Constitution excluded people of color, then you're never going to get it. And if you're unwilling to hear that, then one, I won't continue to spend my time for people who are just unwilling, and spend my time with people who are willing. But then it's just like, it's unfortunate, because the people of Ohio will suffer by having people implement laws who hold these beliefs and are unwilling to learn and challenge their own thought process.
I so appreciate you bringing that up, and I know Camille has other questions to talk, but just the fact of you don't need any more allies, and you need co-conspirators with you. It's so important, because, you know, for so long we've talked about that allyship, right? And yes, going through the motions of understanding, stepping in, stepping out, calling it in, read the books, right? Even now, read the books. There's a list of books, and the calls that are so overwhelming, and the text, and what can I do? And this is not me, or feeling offensive, or that's not the way I walk in my life. And, you know, one of the things that it's so important for those that are transferring or understanding that it's about action, right? That we are done with the labels, or acclimating you to the term, right? Or just because you have that one Black friend, or you eat that plate of food, or you share, or that was your friend. The reality is, how are you showing up, right? And indistinctively of the emotions and the outpouring, and I am hurt, we need some action. And that co-conspiracy is about the action and not just the language. It's not just about reading the books and having the lingo and reading the book by another white woman, which is great, but that's not the all. Or when we talk about this understanding about competency and cultural knowledge and racism, that we're not, none of us are actual competent in anything. That at the moment that we say that we're culturally competent, or that we know the history, we stop learning, and we stop inquiring, and we stop feeling and understanding. And in order for us to get this work done, that is so imperative for all of our constituents, for all of our members, for the nation, for the state, we do need co-conspirators. We need those that are in position of power to let go of their guilt, their shame, right? To not take things so personable, and to use their power, which they have it, to make things change, right? And to hold for transformation and conditions, and at the same time allow us to hold them accountable for the things that they said that they were going to do. So this pass of legislation, or becoming from just a resolution to an actual legislation, when we hold people accountable, where it changes. And when you were speaking about, Representative Crawley, about education and how doctors and nurses treat people of color, right? That starts in the classrooms. And how is it that our institutions are teaching about medicine and pain tolerance and our compositions and our bodies and even our trauma, and the fact of interpreting that because we have lived with trauma for over 400 and some years, that we are more resilient to trauma, that it's okay to continue to kick or to treat in this way, that doesn't have to be to change, and that we have to let it go. And that we're always crying over spilled milk, but the reason is because we don't see movement. And we have to fight so hard for movement to actually occur and change. So So thank you for that. Yes, we do need co-conspirators, and more than allies, and we need to stir away from always asking others to just be allies. We need to not just be invited to the table, we need to create the tables, right? And choose who we want to invite. We also need not just to be invited and left there behind, we need to feel included in the conversations, in the legislation, in the movement, for it to actually make some friction. So thank you for that.
Absolutely. And if I could just add, and I know you have more questions, but to Rep. Brent's, point about people seeing us as like angry Black women. And now, like I used to say, I don't want to be seen as the angry Black woman, but at the end of the day, I'm an angry Black woman. Like I'm angry that we're not moving legislation that can make a difference for my community. I'm angry when I have twin girls who are 16, and my daughter is in my arms crying about being treated differently or not wanting this to her children to experience discrimination based on her skin color. I'm a mom and I got to try to, console my child and tell her that it'll be okay, and being frustrated that this is the world that we live in and that there are people who are okay with the status quo. I'm angry about that because I know my counterparts, my white counterparts, might not be having that conversation, and they aren't, because they don't have to talk about, being discriminated against per se on how they look, and being treated differently, or knowing that their ancestors were slaves, and that there are people who will say, go back to your country. And it's like, I was born here. My daughter's an Afro-Latina. Like, what? This is all she knows. So I am angry about that. I want to see change. In my 150,000 residents who elected me want to see change. And when nothing's moving, I get angry about that. And I have every right to be. And for people to use that as a term to shame or to silence us is unfortunate, and just shows their character. But I will also say, about holding each other accountable, and I know Brent will have something to say about this, but we have colleagues on both sides of the aisle who say like they don't want to talk about racism because of their district, or it'll be problematic for their reelection, or they don't want to talk about police reform, and they don't want to have these conversations because they are running for election. And like I said, it's on both sides of the aisle. So it's in our caucus and across the aisle, and then you're not a co-conspirator, you're complicit. And I don't want to work with you. I don't care if you got an R behind your name or a D behind your name. If you are not willing, if it's all about politics and not about people's lives and talking about the issues that affect people and speaking truth, to Rep. Brent's point, being honest and being truthful, then I don't want to work with you. Because you're not a co-conspirator, you're not an ally, you're standing in the way of progress, and you care more about being reelected than serving people. And at the end of the day, for me, as long as I am out there telling the truth about what's going on, whether it impacts my community or another community, I talk about stuff that happens with business all the time. I talk about all kinds of issues. If people don't want to elect me because I gave them the truth, then I'm fine with that, because I can look myself in the mirror and say that I did what I was supposed to do, and it wasn't about being reelected. And I think that's part of the problem. And I think that's what a lot of people they no longer want people who just care about elections. They want people who care about people and their problems, and finding solutions.
To deal with racism as a public health crisis right now, with everything going on, it's going to take everyone to be uncomfortable. And when someone says like, well, this doesn't make me feel good, or I'm going to have issues in this area. And I was like, well, we've had issues within our education system. We've had issues within our health system. We've had issues within our criminal justice system. We had issues within the red line of our communities. We've had issues in so many different other ways that have been uncomfortable, particularly for our brown and Black people within our communities in the United States for hundreds of years, period. So if you are just now becoming uncomfortable, trust me, boo, I've been uncomfortable my whole life. So join the club. I will give you a distant hug from a distance, because I don't want to catch your corona if you have it. That's for you, Rose. I give you a distant hug, and you, Camilla, I give you a distant hug too. But we all are going to have to be uncomfortable. And the moment people start feeling uncomfortable is the moment that change will occur. You can't tell me, oh, I, am fostering 2 African-American young boys, but I still think it's okay to have a Confederate flag. You can't tell me that my best friend is a Black woman and I'm white, but I think it's okay that the healthcare system disproportionately is not treating African Americans in an equitable way when it comes to our healthcare system. No, it's not just for you to say that you're a true co-conspirator. I'm going to start using it. I'm going to take that word. I'm going to start using it. That we have to do it in action, not just in words. And I don't just need you to be my friend when it's good and we can go play golf together and kiki on the phone. I need to know you have my back in private, but particularly in public. So it has to just show up with action, and we all have a role to play. No one can be quiet now. I don't care what race or nationality, religion, no one can afford to be quiet right now. We all have something we can do right now to speak up for ourselves as well as those around us within our community.
Thank you so much. And one of the hardest parts of my job is having to speak after Rosa speaks, because she's brilliant and I never want to follow anything that she says. And for both of you as well. We really wanted to give an opportunity for folks to ask questions. So just a reminder to put your questions in the chat box if you have them, and we will happily bring those forward. As we've been talking about re-election and the impact that has on decision making, there is an election coming up very quickly. And are there strategies in place or concerns about the election that's coming up, kind of pulling the rug from under all of the progress or efforts or energy or momentum that is going forward with this resolution and with other bills? I'm anticipating, everyone is anticipating, that lame duck session is going to be unlike anything anyone has ever seen. But before the election, from now until November, what kind of a shift or what do you see that looking like that's different than what we've seen in the past?
Well, the one good thing is that every registered voter within the state of Ohio is going to receive an absentee application. The momentum is going to be having to get everyone to fill it out and return it. That's where the energy is going to have to be. And there are a lot of groups that are already starting to get this energy going, and they are organizing and already trying to become friendly with the communities that they want to serve on a future sense. So the energy is already bubbling there, because I always think to myself, everybody has a gift, no matter if it's your time, your money, or your talents. And so people are trying to figure out what are those 3 that they have that they can give to this cause. And so the energy is definitely bubbling there. People just have to hone their efforts on what's going to work best. But the energy 100% is there.
Yeah, I would agree. I don't know that, this will be our first lame duck session being legislators. We're both in our first term. I don't know that I'll be surprised by anything, but if we're going to be there till 2, 3, 4 o'clock in the morning passing stuff in the middle of the night, I hope it's racism as a public health crisis. I hope it's bills around maternal and infant mortality. I hope it's bills around increasing the state minimum wage or establishing a family and medical leave insurance benefits program. I hope it's the things that will make a difference in the pockets of Ohioans, or their livelihood, or their being able to take care of themselves and their family. So, if it gets crazy, I hope it's crazy, radical legislation that will really put Ohio, and I shouldn't say radical because these are just things that people have been asking for decades. It's a shame that some people see it as radical, but we really could lead the state. And so if we're going to pass something, I hope it's those types of pieces of legislation.
So we did get a question in the question box. One of our participants wants to know if there are still active ways to support HCR 31, even though it appears that it's stalled.
Absolutely. And thank you so much for that question. One, you can, everyone who is interested in seeing this move can reach out to the Speaker of the House. As we mentioned earlier, everything kind of moves at the discretion of the Speaker. And so calling his office, writing a letter, as well as to the Senate President, so it doesn't stall out over there. It is in the Health and Human Services or Medicaid Committee. Write a letter to the Senate President, as well as every legislator that sits on that committee, and saying that, you know, you want to see this go to the floor for a vote. And so that's one way to be involved. As the Senate continues to have hearings, which I hope they just go ahead and move it to a floor vote, if you want to come down and give testimony, you can do so. Or if you can't come down to the State House, or you don't feel comfortable because we still are dealing with the pandemic, you are more than welcome to offer written testimony only. But if you want to come down, you still have to submit written testimony, but you are absolutely more than welcome to come to the State House, to the People's House, and provide your testimony there. And we can provide information to the Alliance, and so you can get that out to participants when they're going to have another hearing, or how they can be involved in the legislative process.
If we can get 100 people or more to email rep72@ohiohouse.gov, that is a direct email for the Speaker of the House. I'm not going to sugarcoat it. I'm going to give you take you straight there, because we cannot play games with what's going on right now. He is the person who's making the decision if this will get to the floor of the House or not. So I need everyone underneath the sound of my voice to write it down, rep72@ohiohouse.gov. I need you to email and find 10 other people to email with you too. And once you find those 10 people, tell them they have to email and find 10 other people too. And we have to build up momentum.
Absolutely.
Because what we're having to deal with now is barriers that people don't know the process. So now that we are learning about the process, that the Speaker of the House is the one who determines if this bill gets a hearing, we all have work to do. That is everyone's homework assignment.
Thank you.
That is a great call to action, actually. So we appreciate that. We did put it on the chat for those to see it. So once again, rep72@ohiohouse.gov.
Yes.
I don't have authorization for this, but it'll also be on our social media later, probably.
Thank you.
That's not my job. I don't have control over that, but. And this is a question related to that is, it might sound silly, but sometimes I wonder about this when I'm thinking about how to bombard Senate and House offices with information and, you know, trying to get things moving. Are there still fax machines in those offices? Because sometimes when I feel like no one's listening, I just want to send like 8 million faxes, just because that would be unusual and unconventional. But I don't know.
So we do have fax numbers, but they get converted into emails. So we don't actually, there's not like a physical fax machine. It just gets scanned over into our email boxes.
Thank you for that info. I will therefore not pursue that strategy. There have been times where Rose is like, why fax though, Camille? I'm like, I just think it's interesting. I think we have another question in the box. Let me see if I can. I think I made a mistake in pausing my screen. Rosa, are you able to see the question?
I am trying to, but it actually hit, so for some reason.
Well, if I'm not able to find that, we will certainly send any follow-up emails along to your staff. but I'm wondering if we have a few minutes left, if you can speak to a bit about any legislation or any decisions or conversations that are happening right now around schools and returning to school in the fall. We know that working parents are heavily impacted, and as you mentioned, that the majority of frontline workers in this pandemic are people of color, and so the school decisions are going to have a heavy impact. And I'm wondering if you can speak to that issue as it stands right now.
Well, I honestly would not expect much out of the Ohio House. And the reason why, because the speaker is talking about not calling us back till October. And school, for most normal school districts, start in August or September. So even though right now the world is crumbling with COVID and the other things that it affects, we're not even in session right now. We're on recess. So how much does that say to the world of how we're taking care of the people when the State House is the people's house? So I'm just very disappointed. Like Rep. Crawley said, our minority leader, Amelia Sykes, has asked for us to not be in session anymore so we can address things such as our schools, because there are disparities when it comes to connectivity, when it comes to access to PPE, when it comes to access to testing. So that is not being addressed right now within the General Assembly.
So I was trying to look to see, there are a few pieces of legislation that we have introduced to for COVID-19, some of it by myself and Representative Sebeki around transportation, as well as things related to the financial. I think they have to do a 5-year forecast and pushing that back until I think September, December. There's legislation around that. Also, there has been legislation on standardized testing, like waiving assessments. I know for House Bill 239 that I have with Representative Gail Manning that passed out of the House earlier, a few months ago, right before we went on recess, kind of put a moratorium on the third grade reading guarantee and penalizing students who did not pass it, so not holding them back. I know there was language in the bill, I think it was House Bill 167 or 197, don't quote me on that, we can get it to you, that dealt with the third grade reading guarantee. And so then House Bill 239 also did that as well. So there's a couple pieces of legislation, and like I said, we can get that to you to share, but if we're not coming back, we're coming back to the House probably not until October, and schools start next month. And so unfortunately, the issues and concerns that some of the schools have that need to be addressed through legislation, whether it's changing some things in the Ohio Revised Code that prohibit schools from doing different things, and now they need more flexibility, won't happen before then. And obviously, if anything that goes on in the House still has to go over to the Senate. And then we need to try to concur, go to conference. So it's unfortunate because schools won't necessarily have what they need. There has been, I think today, there was a request from the Department of Education for the controlling board to release more CARES Act funding, which is going to be vital to reopening schools. And I know schools are offering different plans for, students coming back, whether it's a hybrid of virtual and in classroom and just a couple of days a week. But schools are really struggling with budgets when it comes to making sure that everybody has hand sanitizer, and that's accessible, whether it's masks and then just other things to be in line with the CDC's guidelines on hygiene around the pandemic. I know there's concerns about, well, if kids are going to school and they have to have transportation, how are we, making sure that there is a safe distance on the bus? And then there's, I have Columbus City Schools, which is the largest school district, and they have like 26 different bell schedules. And, they are transporting students to charter schools and other schools outside of the district. how is that going to be managed? And then also maintaining social distancing on the school bus, and then making sure that all of the seats are clean and sanitized. It's just a lot. And again, if we're not in session, then we're not passing any legislation that deals with that. But hopefully, when it comes to the CARES Act funding that's coming from the federal government down to the states, like I said, the controlling board met today. I think that they were going to approve that appropriation. So at least schools will have funding if they can't have legislation around it.
If in the process of being not meeting again, there is a declaration of a shutdown, what is in place, right? So if we continue to see these numbers continue to peak, if people are not, unfortunately, I once said that even though there might be laws or anything in place, right, or protocols in place, at the end of the day, it's like everybody to themselves, in the sense of you do what you need to do, because people are not following a lot of the protocols, right? Unfortunately, which is the truth. Is there a game plan in place if we need to extend the $600 for federal? And I know that comes from federal, and we already extended the 20-week for unemployment in the state of Ohio. But if there's a complete shutdown, what would be the game plan? What would be some of the recommendations that you would give the constituents in the state of Ohio?
That's a good question.
That is a good question.
I don't know what the game plan is. I know that we have put forth a lot of, different pieces of legislation. Originally, when we first went into shutdown, around supporting workers, and then making sure that there were, people who were considered gig workers and who didn't fall under the regular unemployment would still, get funding. And luckily, the federal government, took care of that. But going forward, I'm not sure. We still have a rainy day fund that has over $2.7 billion in it, or somewhere around there. And, people have said that it's been raining, and I know the governor has been very conservative and wanting to hold on to that. And just a few weeks ago, or a month ago, our unemployment, there was a dispatch article saying that our unemployment insurance fund was broke, but then, people would still get their benefits. And I still have a constituent who applied for benefits as soon as the pandemic hit and they were affected. They still have not been approved for benefits. They have an appeal hearing today. And so I would like to think that if there is a shutdown, which people, I don't know if the governor will declare one. Obviously, there was a lot of pressure on him to reopen for businesses. And now we see businesses arbitrarily closing because their staff is getting infected, especially bars and restaurants. And so now they're having to close again and stay closed at least 2 weeks for quarantining. So I think we'll continue to see that, but we still have a rainy day fund if we need to use it. So that would be my recommendation.
I'm going to have a reaction, and it's going to sound very generic, but I feel like it's much deeper than, but just vote. Everyone who's making a decision right now, from your state rep, your state senators, your congressperson, your senators, we are all on the ballot. And if we are not treating you fairly, we are all on the ballot this November. So it might sound simple, but if people aren't treating you right, if they're not answering the phones, like all of the unemployment claims are going through our offices. Mm-hmm. Anybody who's a state rep, me, Rep Crawley, I just know this Saturday and Sunday, when I could have been outside enjoying sitting in my backyard being social distancing, I was answering people's questions about unemployment. And I know Rep Crawley, she does a heck of a job of reaching out to her constituents. I sent her an email about something. She responded 2 minutes later, like she's real quick with it. Mm-hmm. But we need more Rep Crawleys that are being responsive to their constituents. And if your person that represents you is not being responsive, they're not acting, they're not demanding things from the speaker or demanding things from the governor that represents you, it's time to, they about to lose their job. So it's time to do that right now with action.
And I will say, I will add, my legislative aide, Kelsey, is on the call, I believe, and she is the one, our legislative aides fields these calls. And then when, like Rep. Brent said over the weekend, people want to talk to the legislator a lot. They're like, okay, I'm glad you answered the phone, legislative aide so-and-so, but I need to speak to Rep. Brent. Or we're like, okay, they weren't satisfied with the help that our legislative aide gave, so we're reaching out and on Saturday and Sunday talking to constituents, because they don't have, like, their house is on fire. They're like, I'm getting ready to be evicted, or I don't have money for food, or, like, they're in crises. And so they expect us to answer the phone whatever time it is, and that's what we are elected to do. But there are many of us who are colleagues who are not responsive. And so to her point, like, you need to make sure that people are working for you. And it's unfortunate that, we always have to go to that, but that's the case. Elections have consequences. As much as we want to do the work and we're like, hey, people are struggling. If there's no political will, or the people who are in charge and can move things, there's only so much Rep. Brent and I can do. And I know people get all weirded out when we talk about the rainy day fund, because that is a security. And going into COVID-19, our state was doing really well with revenue. And I'm not saying like we just, withdraw all of the money right away, but as this pandemic moves on and we continue to see an increase and people are affected, if we're not getting revenues in and revenue is down because businesses have been closed and we pushed the tax date, filing deadline back, then at some point in time, it's not okay for me to continue to talk to my neighbors. And I'm like, I can't help you. They're not, that doesn't work. That doesn't work. And I see it firsthand because I'm on the border of Reynoldsburg and Columbus. So I'm on the border of Columbus and Reynoldsburg. I could tell you they have a new food bank, and going up Main Street, traffic will be backed up all the way past 270 going like in town from people like waiting to go to the food bank who have never been there before. And we're talking about people in Mercedes Benzes and BMWs in nice cars with a family full of people getting free food because they don't have the money to put food on the table. And I have to, I look at these people every day because this is my community. And if I'm getting pressure, then I'm going to pressure the people who, can make a change. And that's what we all should be doing. And if they don't move, November, you have a choice to have your voice heard.
Yeah, for many of your constituents, for many of our members, for many of survivors in the state of Ohio, it stopped raining a long time ago and it's actually pouring.
Mm-hmm.
So to think, right, that there's a reserve and that is not being tapped to when you do have so much need, right? And those needs are acute. You can't wait for another week of a response, or you cannot wait for it to funnel through the federal level when there's something there to do. So it started pouring a long time ago.
Well, especially if we don't have moratoriums, like we asked our public utilities not to cut off people's water or cut off their lights or their gas, and everybody is starting, and I know it's 3 o'clock, I'm sorry, but I know people are starting to get notifications where people can be evicted, like they're holding eviction hearings, and that's getting ready to get crazy. People have reached out to my office, and at the end of this month, they will start disconnecting. And so you have people who have been waiting for unemployment, and they probably will get thousands of dollars, and that's something that's subjective. Somebody could be like, oh, I don't agree with this, and deny their claim. I mean, what do we do then? These are the things that people are asking me, like, I am getting ready to get evicted, and I'm saying, can you give me your landlord's number? And I'm calling the landlord and asking them to give more time. And that's what we do as legislators. Obviously, we don't just pass laws, but I'm making calls to landlords like, can you please just give them a little bit more time?
It's interesting as we talk about just how we treat people. If we don't take care of people, trying to keep them where they're at in their homes with their children, keeping families whole, then we're going to have to take care of them on the back end by opening up more homeless shelters. Now, if we're dealing with a pandemic, that's even going to have even more long-term damage on our communities if we don't do what we need to do right now. my aide Taylor, shout out to Taylor, I don't think she's on the call, but she called me because we were calling back all the people from unemployment, and she said that it was multiple people crying on the phone because they have never received anybody calling them back. Mothers, fathers, older people, people with disabilities trying to get through with their unemployment. So we have to take care of the people, and that's the whole thing of being a public servant. I'm just not somebody that's elected. I'm here to serve the public, and our people are in need of it. So you have to hold your elected officials accountable, and if they're not doing their job, tell them you about to lose your job. We just have to. We just have to take care of our people.
Yeah. And to survivors, especially, especially people who are losing their homes or, are in a bad situation and aren't getting any unemployment, and they are actually putting their lives at risk by staying in an unhealthy situation because they have nowhere to go, or they don't have any money, or they won't be able to take care of themselves. And people should not have to choose between their life and, having a place to go or no money. And those are the situations that people are in right now. Or, because they're, they don't have their unemployment or they're not working, and the landlord is like, well, if you don't have any money, how else can you pay me? As you said earlier, Rosa. And we get those calls too. And it's unfortunate. So thank you for your time. Thank you for having us.
Thank you both so much. This has been absolutely wonderful, and we know you are just extremely, extremely busy. So we will definitely be posting the call to action, and we will get you far more than 100 or 72 at ohiohouse.gov emails. And please continue to let us know if there's anything that we can do to support your legislation. We will continue to monitor what's going on the calendar. We'll continue to push for the resolution and also for the other bills that really are meant to make progress to the same end. So we'll be watching for those. And Rosa, do you have anything you'd like to say in closing?
Just once again, thank you very much for all your work, for showing how it actually really does affect, especially being minorities, women of color, and holding this weight over your shoulder, and how it actually affects you personally. So thank you. We ask that you continue the fight, to know that you do have co-conspirators here from a sexual assault coalition willing to do the work with you, and in full transparency, and understanding that this is vital for us, that we do understand that in order to eradicate sexual violence, we have to do it with an anti-oppressive framework, and we have to do it from the lens of racial equity. And that is extremely important. So I thank you both, and we hope that you can continue to be healthy and safe as you continue to do this work.
Thank you. Same to you.
Thank you so much.
Thank you.